Hello, everyone on Facebook, on Instagram, and on YouTube. Welcome, welcome. Today, I'm going to be talking about how to study all the major topics. How are we going to study all the major topics for the hand exam prep program? For the hand exam in half the time. So welcome. Thank you so much for joining me. Let me know where you're joining in from. Say hello. We're not strangers. My name is Huang with Hand Therapy Secrets, and I run the hand exam prep program, getting people to be ready for the exam. I'm so excited. We finished our last 12-week round last night. We ended up in nerves, and really excited for all of those people ready to take the exam in May. They've been working so hard. They have been working so hard. Hi from the UK. That's so awesome. We actually have one of our students from over there in Ireland, so around that world. And it's such a pleasure to be able to kind of meet so many therapists from around the world. It's really cool. So nice to meet you. I'm from Miami. I'm actually live coming from my clinic. I own hands-on therapy services. So we're wrapping up the day. It's been really busy, which is always really, really good. Busy means that we got to help a lot of people. So really excellent. So thank you for everyone who's joining. So we're just going to talk about, I think last time we talked about planning and stuff like that. I'm going to incorporate some of that in our conversations, because as this group, so the hand exam to become a certified hand therapist is given out twice a year. Back in the day when I did it, it was like once a year. So if you missed it, that was it. You had to wait a whole year again. But now they give it out twice. So it's in May and in November. And it used to be, before COVID, was given out for like literally a week. And that's all you had. You had a week's time, and that was it. With COVID, they had to spread all the stuff out and all the people out and all sorts of stuff. And so now they're giving it for almost like 2.5 weeks, almost 3 weeks. So, we'll see if they continue that, or if they if they change it back to the way it used to be. But right now, as it stands, the test is given out at the end, not this week, but next week, the end of next week, and then all like this 2 weeks of May. So cheers. Go look for all those people who are studying. I know that it can be nerve-wracking. It is nerve-wracking. And may I offer some words of encouragement? Take a little sip of my wine spritzer. Like, hello, it's almost happy hour. It's so words of encouragement. That I do this with my students, so it doesn't matter if you're in my program or not my program. I really want to encourage you not only to take it, because we desperately need more certified hand therapists out there, and I think we need more occupational therapists who are specialized and especially specialized in hand therapy. My belief has always been that if you specialize in hand therapy, that you have the ability and the know-how and the desire, that inner drive within you to do even more, and to continue that studying and continue that essentially that specialty or that learning. It's a continuous learning that we do that really gives us purpose, prevents burnout, all that good stuff, right? So if anyone is, whether you're listening to me right now, or if you're listening to this on replay, if you're about to sit for the exam, please let me give you this one tip. I'm just going to keep it really simple, this one tip. And really, it's about believing in yourself, right? It's a belief in yourself that no matter what, you're going to be fine. No matter what, you're going to do really well. The fact that you even sat and studied for this exam enough to feel like you can take the exam, it should show you enough. It should tell you enough that that you are great, right? And that you're doing what majority of people don't do, right? And you trusted yourself all this time. Continue to trust. Continue to trust yourself throughout the exam, throughout that whole process. And the results are what they are. The results are what they are, but the results say nothing about who you are, say nothing about who you're becoming, right? Say nothing about whether you're a great therapist or not a great therapist. The results do not say that, right? It does not say that. The results have no opinion other than it gives you a very definitive pass or fail. That's it. So if you're coming in there and you have a belief in yourself that no matter what happens, you're going to be fine, you're putting yourself in a better mental state if you can manage those types of feelings, right? That's to all my members, all my students, anyone who's not in a program, but you follow me, thank you so much. If you watch any of my videos on YouTube, if you watch my stuff on Instagram or on Facebook, thank you so much. I hope that you take that and you can remember to utilize that when you're taking the exam. Now, for everyone who is gearing up, right? If you are gearing up to study and to prepare for the exam, I'm going to kind of cover today how to study all the major topics in half the time. And in half the time is relative. I just want to say in half the time is relative. It's relative because it is about how much you would have done had you, given it this much intention, right? So not everyone has the same plan. Please don't compare yourself. Somebody might have been like, oh, I studied and, did it in 3 months and did it in 6 months. And really it doesn't matter because we don't know the whole story. We don't know how they study. We don't know their internal and external barriers, that kind of stuff. So, so the key thing is you focus on yourself. You focus on yourself and what you need to do and how you need to do it so that you can prepare. If you don't prepare, you're not going to want to sit for that exam. And if you don't prepare, but you do sit for the exam, majority, I don't want to say majority, I don't want to say all, but like everyone that I've known who's ever been like half-assed exam has failed, right? Everyone who's worked a ton of years but barely studied has failed. So, I mean, I've heard lots of stories. I haven't heard them all. I have not heard them all. So, I'm just saying from my perspective, those people who don't study tend to fail, right? Hey, listen, even the people who study really hard fail. So here's what do we need to do to help you increase your chances, right? Because at the end of the day, in the exam, you just really don't know what kind of questions you're going to get. And that's the truth. There's a slew of topics, essentially a slew of topics that you need to go through and you need to study for, but you just never know what type of questions you're going to have. Like multiple choice questions, at least you have 4 choices you can rule in and rule out. Man, some of those true false questions, that's like 50-50. I don't really love those questions either, but you just never know the topic, the types of questions, the scenarios that you're going to get. So how do you study all the major topics in half the time? Well, number one, I'm just going to tell you, number one is join my program, the hand exam prep program. And one of the reasons why I could really say this about people studying in half the time is because I have a ton of videos in there. I mean, like almost 200 videos in there that are very much like Cliff Notes, right? They're very much like Cliff Notes. You watch it. I've read the chapters. I found all the key information. I've explained it in a very particular way that will help you solidify the information and connect the dots, right? People who use the videos use other resources too, but you can essentially, like if you're using Rehab of the Hand or the Purple Book and stuff like that, people use the videos to then speed up their reading so that they don't have to sit there and read. And for a lot of people in the program, especially this last cohort, they're like, I'm not even, I don't even really feel the need to read that much, or they're reading the very particular chapters that they need to read and not having to feel like they need to read the whole 2 volumes. And then I just help them keep structure and keep pace, so that they could stay on task, so they can stay on the pace that they have set for themselves. And regardless of whether you go slow or go fast in the program, I help set that pace, right? So now, if you are not in the program, still stay tuned, right? Still stay tuned, because I'm going to share some of the stuff here. If you do not have access to my program, then do this. Now, if you want to get the details of my program, if you're on Instagram, you can go to the link in my bio and ask for the details of the program. On the website, handtherapysecrets.com, you can request the details of the program, or even, book a call. I've opened up my schedule. Is it this week and then next week? Because the program is open for enrollment. If you are interested in having a private conversation with me, then let's set up a call, right? So let's talk about this, right? So how do you do it in half the time? So you really want to create your plan. You really want to create your plan. And I believe was it Monday that I did a call on creating that plan. So what does your plan what is it? What does it need to look like? Is it a 6-month plan? Is it a 12-month plan? What is your plan? If you're 2 years out, I'm going to tell you right now that studying for the exam is really hard, because there's nothing that's really motivating you to sit and study for something so detailed and then being able to remember everything. So whenever you're ready to study for it, just like buckle down and study. Everyone who tells me, oh, they're 3 years out for the exam, but they're going to buy their books and they're going to study now. You're going to dabble, but that's not studying. You're going to dabble, but that's not studying. You're going to look up some stuff because you have this case or that case, and you just want to really quickly figure out what you need to do, but you're not going to study, right? Studying and preparing for this exam needs to be done in a solidified way, or consolidated way, so that the information that you need, the amount of detailed information that you need to know, stays in your head long enough so you can answer a question. Because let's be honest, when you're treating, you don't need to know all the minute details. You need to make decisions, and you need to make decisions fast. And at the end of the day, as a certified hand therapist, you know the resources. You know where to look, right? Like, I just met with a lawyer, separate conversation. I met with a lawyer today. Those people have to pass the bar. And they study for very specific amounts of time, so they pass it. But really, at the end of the day, they know exactly where to look. If they're looking up a law thing, or if they're, disputing something, they look into their books. That's just like us. You think doctors who pass their boards never look at their books and never go back to their books and say, oh, like, let me double check this. Of course we do. But studying for a certain period amount of time really allows them to test. Should we give you those letters because you know how to critically think through a problem, solve that problem, and make decisions to solve that problem, right? So that's what we are when we're certified hand therapists. It really should say to you, I know how to solve this problem. If I see a tendon that comes in, a laceration on the hand that comes in, I'm pretty sure, I'm confident it's that tendon, right? I know if they cut that tendon, they're going to need to fix it. And I know that if they fix that tendon, this is the type of split, this is the wound care that needs to be provided, and this is the movement protocol, or how I'm safe to move this patient in this time, in this time, and in this time, right? Without, like, you don't have to go to the doctor. The doctor should trust that you know what you're doing. And they do. They're looking for people who they can trust know what they're doing. right? So if I look at the hand, I mean, yeah, if I look at the script, it's like index finger, last, whatever. I know it's either one tendon or two tendons, right? But I know what to do. And I know how to tell the patient, well, you're allowed to do this, you're allowed to do this. It's going to take this long, right? It's going to take this long. And I need you to, you're safe to do X, Y, and Z, but don't do this. Don't push on it right now. You're not ready, right? I know what to say to give them ease. I actually had a patient today, post-surgical extensor tendon zone 5. So if it's the laceration is coming in and it's like this, right? I know it's either one or two tendons. Most likely it's two tendons because your EDC is right here and your indice is right here. So if he's cut that, at least it's just one tendon. I mean, it's just one finger, but at least two tendons potentially, right? So they have the capacity to make full recovery, and me being able to have a conversation with him about, you're coming in to me at 4 weeks, kind of late, but that's okay. Sit you're still in, but that's okay. We're going to clean that up. We're going to make your hand look really nice, really pretty, so that you can feel comfortable touching it, moving it, and all that good stuff, right? I always talk about like, oh, it looks pretty. The prettiness isn't for it to look pretty. The prettiness of a hand is so that you feel comfortable touching it, moving it, doing the things you need so that we can have the progress that we want to have, right? So when you're studying, you have, or you can have, or you can come to have such an understanding that you are comfortable having conversations like this, regardless of whether you saw the script, regardless of whether you talk to the surgeon or whatever, right? So over a period of time, when you can see a patient like that, you can develop that kind of relationship with the surgeon where the surgeon trusts you. Period, right? So grab the details of my program if you're interested. 2, if you don't have access to my program, let's do this. 1, have a plan. So you've got to make your determination. Ooh, you cannot see that. Let's see. I'm gonna have to change out all my markers pretty soon. 1, have a plan, right? Are you talking about 6 months or are you talking about 12-month plan? Let's have a plan, because then that's how you can break it up, right? Now, I might not be able to write all this down, but all right, that's okay. Just listen to me. Take notes later. Come back to this as many times as you need. So this is how I break it up, and this is how I think it's important for you to consider chunking it up in this way. Hands. So everything that's related to hands. So really when I say hands, I'm talking about fingers, I'm talking about metacarpals, I'm talking about thumbs, right? So that's a huge amount of chapters, a huge amount of topics, right? So I'm talking about fractures, I'm talking about dislocations, and that kind of stuff, right? And then we're going to go into wrist. So it's hands, right? And then wrist. So then in wrist, you want to then break it up into fractures, dislocations, and then the TFCC, right? And when I talk about wrist, I'm talking about distal radius and ulna as well, right? So here's your segment of wrist. What do you need to know about those types of cases? And then, so chunk up your chapters in whatever resources you want to use. Rehab of the hand, that's my #1 resource. I think that is a key resource to use to ensure that you'll study in a way to help you understand concepts and be able to pass. Or some people have the purple book. Now the purple book is just broken up differently. So, but that's okay. One thing that I do is that I just then go through the book in a different way. Like I go by topic. These are resources that you can use. It's not necessarily a novel, so you don't have to read it from like front to back. You can chunk up your information, and that's one way to get through the material faster, right? So chunk it up. So hands, wrist, and then tendons. So chunk up your tendon stuff. So your tendons are going to be your flexor tendons, your extensor tendons, and it's going to be throughout the hand and the forearm, right? Now, burns and wounds, there's huge sections on burns, and that has to do with like how you take care of scars and the types of burns and the layers of burns, stuff like that. And then wounds. Wounds are going to go into your grafting, and it covers the whole extremity. But one of the most important parts about burns and wounds that we go over are grafts. So you can have different types of amputations, some different types of injuries where like a lot of soft tissue is lost, whether it be in burns or whether it be in different types of accidents. Like we had a really severe case come in like several months back. She had a mixture of grafts and like full thickness and partial. And it was funny because she kind of had been going somewhere else, not in this state. She was going somewhere else, and she was just making a comment like, oh, like the therapist that she went to didn't know the differences, and because she had multiple different types of grafts and soft tissue coverage. So chunk those things up. And burns and wounds can cover between the hand, the wrist, the elbow, anywhere. It could be related back to like different types of accidents where they take different parts of the body to cover the injuries to the arm. So just know those. That's what I usually cover under burns and wounds. And then elbows. So then it becomes fractures, dislocations, and then also fracture dislocations. Then we have shoulders, and then shoulders is the same way. It's fractures, ligament types of issues. So, and then you have an array of other topics that kind of relate it back to shoulders as well. It could be like arthritis, rheumatoid arthritis, and all the surgeries that are essentially associated with them, right? And then nerves. So one of the reasons why I break it up in that order, right? So I'm going to say it again. I go hands, wrists, tendons, burns and wounds, elbows, shoulders, and nerves. One of the major reasons why I do that is because the information that you learn starts to compound, right? Compounds over time. You're not learning in a vacuum. You're learning compounded over time. A fracture is a fracture is a fracture. Ligaments are ligaments are ligaments, right? Nerves are nerves are nerves. And so when you learn one aspect about something, you can apply that concept to other body parts, to other diagnoses. And that's how you can study in half the time. Study in half the time. It's about applying concepts, right? Instead of just memorizing things. People who just memorize things can sometimes have a really hard time then applying it to the clinic, because all you've done is like, I'm just trying to memorize it so I can pass the test, versus understanding it in a certain way so that you can take the knowledge base that you have and really apply it to your patients. I mean, the whole point of this is so that you become, you be the CHT so that you can become the CHT, right? It's that critical thinking, problem solving, and then making decisions. And it's in the making decisions that can lead you to become the expert in your area, right? People are coming to you, doctors are coming to you, surgeons that you work with come to you for your expertise knowledge. Sometimes they don't come to you. Sometimes you go to them and you show them what you know, right? What your patients need. That's how you advocate for yourself. That's how you advocate for your patients. It's not just saying that I'm a CHT. It's not just saying I'm an occupational therapist, right? It's about, the results that you get for your people, right? The results that you get for your patients. And your results speak louder than anything that you can say about your letters, any set of letters you have. All right. So I go over those topics. So there's 7 major topics that I break up. And then here's the kicker, right? Because we didn't just end right there. We got other topics that we have to cover, okay? So, how do we cover this and apply it to everything? Orthosis. Orthosis is a huge topic that will take you from hands, wrists, elbow, even potentially shoulder. And you have to understand the principles. You have to know how to apply it, when to use it, how to use it, all types. And so when you learn all those other topics, make sure that you insert orthosis in there along the way, right? You don't have to know how to make one, but you sure as hell have to know the principles of how to make one if you were to make one. So if you think, oh my God, I can't study for the CHT, I can't become a CHT because my splints look like shit, it don't matter. They don't care. They're not looking at like how pretty your splint is. You know, only other people who judge your splints are other CHTs, right? I'm really guilty of this. So I apologize if I've, said anything to other people, but let's face it, splints can hurt your patients. Done wrong can hurt them, right? So that's why I'm kind of like big on it, but because I don't really think that everyone has to have one, but you have to know when to apply it. You have to know when to discharge it. So key. Just because you apply, don't mean that they need to keep it on forever. So, orthosis is a huge topic that can run through all the other topics as well. Modalities. If you know me, if you've been listening, if you watch any of my videos or something, you might know that I'm not a huge fan of modalities. But did I need to study it? Yes, I did. Do you need to study it? Yes, you do. So whether you use it or not use it, love it or don't love it, you need to know how it's applied and when is the best time to apply it. Oh, thank you so much. The hand therapy group. Thanks for watching. So yeah, so that. What else? Different types of treatment methods. So for example, one treatment method might be like kinesiotaping, might be manual therapy, might be exercise based, right? These are all treatment methods, and you need to know the basics, the principles, not necessarily how to do it, but when to do it, why to do it, and then to a certain extent how to do it, because it's you have to be able to describe it, you have to be able to read the words that are written and then visualize it and say, okay, that's the right movement versus this one, not the right movement, right? So these are treatment methods. And then we have pediatrics. Congenital, normal types of injuries, you definitely need to know some pediatric information. It's funny, I will, get questions from peds therapists who work in orthopeds, right? Now you might see other peds, but the chunk of your time is in orthopeds. Can you become a certified hand therapist? Yes, you can. You can, because you have a lot of hours. Now, CHT doesn't say only work with adults, right? Absolutely not. The CHT says, it's essentially the HTCC, the commission, essentially, that are the ones that give you the letters. I don't give you the letters. I just help you to get them. But they're the ones who say that it's really anyone with 2 hands and 2 arms. They don't say it like that. I say it like that. But every hand and upper extremity type of injury that you're treating, it does not say you only treat it at this, small point in time. Adults, you can treat, like I actually had, oh my God, one of my worst splinting experience was in the NICU. I was having to make a splint for a preemie. Okay, I mean, like, it took me an hour and a half. If I knew then what I know now, it would not have taken me that long. But I was like shitting bullets. Like, I was in a gowned up, sweating. This poor baby didn't need to be stimulated that long. And I was here trying to make this splint because he was born with abnormal hands, missing a thumb bone and stuff like that. So yeah, it was crazy. So that's upper extremity. I was working in the NICU with babies that had brachial plexus injuries, right? Like, so you're not limited by an age. You're not limited by working in geriatrics either. Old people got hands. I'm about to, hopefully, if we're lucky, we'll get that old, right? Am I right? If we're lucky, we'll get that old, and we'll be able to, hopefully, be able to have great therapists who work on us to make sure that our shoulders and our hands and our elbows still work as pain-free as possible, so we can do all of our functional tasks, right? So it isn't just tendons, it isn't just fractures, it is the realm of someone's lifespan, through lots and lots of different diagnoses that affect the hand and arm. Strokes. Oh my God, people. Strokes. Yes, the injury is up here, but the deficit's down here, right? I currently have this kid that I'm working with, traumatic brain injury, and presents like a stroke. So he comes in with this, this arm's got some tone, and it's incredible to work with people like that. It's incredible to work with people like that. Do they respond as well as a tendon? Do we see the results as fast as a tendon? Do they keep the results as fast as a tendon? No, but do they deserve, really great quality therapy, hand therapy, neuro-based therapy? Absolutely. And I always say, like, every neuro case becomes an orthopedic case at some point or another. They really do. So those essentially are the other topics. So orthosis, modalities, treatment methods, pediatrics, and neuro. So out of the 7, now you have about like 5 more topics, right? But how do you integrate all of those topics so that it's not new every time? That's how you cut your study time in half, right? That's how you cut your study time in half. Now, the other thing is you have to ask yourself, I'm not even going to use the board. I'm not set up to use the board right now. You want to ask yourself, what are you really good at, right? Ask yourself, what are you really good at? What are you not so good at? So if you write those topics down, right? Break it up even into smaller chunks. Like I already gave you an example: fractures, ligaments, that kind of stuff. What are you good at? What are you not good at doing? So one of the ways that you can keep that cadence or momentum of study is that you study what you're good at first. Like, get in there and do the good stuff. Like, didn't I just say we are human beings that do things that are easiest to us first before we even get to the hard stuff? That's just human nature. It's just human nature, right? So if we know human nature, can we use human nature to our advantage? So you've got to study something hard, something easy, something that you like, and then do something that's a little bit, more challenging, maybe something you don't like. So something good, something bad, something good, something bad. That way you can keep the cadence going, and that will help you be able to study all the major topics in half the time. No wonder. Jen, I'm coming. I told you 5:30. So Jen's supposed to meet her for drinks and dinner. Cheers, girl. I'm having a drink first, and then I'll join you in a few minutes. I'm giving people gems. Anyone got gems from here? If you have, then please drop some hearts, leave some comments. What are some of your key takeaways so far? Whether you're watching this live or whether you are watching this on replay, let me know what's helping you, and if there's anything that you're taking out so far that is going to help you cut your study time in half. Chunking is a huge part of organizing yourself in a way that helps you study in half the time. If you don't get organized, it's very hard to get through the material at a particular cadence that will cut your study time down in half, right? So sometimes when you see people take years and years and years to study, it's because they weren't really studying that whole time. It was dabbling a little bit here and here and here, right? But you create your plan, you get your shit organized, and you're going to be able to go through the material faster at a particular cadence that will help you feel prepared to sit for the exam. Right? So what are you good at? What are you not good at? And you're going to have to do the work. You're going to have to do the work. You've got to like be honest with yourself. And the thing that you didn't want to study, now you're going to need to study, right? Now you're going to need to study, because if you don't get to it, you're going to miss a huge chunk. One of the things that I often hear is if they don't like it, they leave it to the end, until the end, until the end, until the end. And then, oh my God, I either am taking the test and I haven't studied that huge chunk, right? For example, OTs sometimes don't have the opportunities, or don't take the opportunities to really work a lot with shoulder patients, right? And I'll tell you right now that a lot of your hand and wrist people have shoulder problems. Take these opportunities to get some shoulder work in, right? Because if you don't understand and know enough about shoulders, it really hurts you when you're getting into nerves, right? If you don't know enough about shoulders and what to do, it's going to really hurt you when you're working with elbows, and when you're working with compressive types of neuro types of issues, when you're studying for the exam and when you are treating, right? When you're answering questions on the exam. So it's not just about memorization, but it's really about being able to problem solve, and make decisions on what to do next. All right. So what are you good at? What are you not really good at? So how do you pair that up with where are your experiences? Where are your experiences? Where do you have the most experiences, and where do you lack your experiences? And that's going to be a key role, in terms of how you study and what you study. So again, if it's our human nature to do the thing we like, we're going to study on the things that we see the most of. So somehow we have to be perfect and have to know everything about that, but then we don't spend enough amount of time on the things that we don't know well enough. And that somehow it's going to, if I just get lucky this time around, they're only going to ask me questions on like the things that I like and that the things that I'm good at, and not include all the other stuff. Well, it really doesn't take that many questions to get wrong, right? So in a way, you need to know everything, because you just never know what type of question you're going to face on the exam. And if you don't know and you're not confident, it really erodes at how you approach the exam. And when you don't feel good and you don't feel confident, it really puts in a lot of doubt, and you second guessing yourself and things like that. So just keep that in mind in terms of breaking up your topics so that you can study in half the time, right? Plan, organize, and now this will guide you in your actual studying part. So get your resources, whether it be the Rehab of the Hand, the Purple Book, the ASHTA book, any other resources. Some people like Sherry's like anatomy book to really understand anatomy. What else? What's another resource? I would say be careful with YouTube videos. I mean, I have a bunch of YouTube videos out. Thank you very much if you are the ones that watch it. But very specifically, I put stuff out for the exam or to improve your skills. So it's not beyond the scope of occupational therapy and what we're doing here to become a certified hand therapist. But I always say be careful with YouTube videos, because they introduce a lot of uncertainty, because they introduce a lot of extra things that we may not need to know as it relates to becoming a certified hand therapist. If I'm here only helping you to become a certified hand therapist, I need to how do you say, consolidate the information in a way that helps you stay focused. You start looking but this resource said this and this research, and let me get this huge anatomy book and this huge whatever kinesiology book, might be beyond the scope of what you need to know as it relates to what you need to do as a certified hand therapist. And that is the key thing when you're studying. There's already a lot of information. Dear Lord, have mercy. Can we not add more shit to the plate, right? So, definitely take a look at your resources. When it comes to reading, oh shoot, I wish I had my book. I only have the Purple book next to me, but it's not relevant to. So when it comes to Rehab of the Hand, right? when it comes to rehab of the hand, this is how I recommend reading, right? You want to read in chunks. You know, I love chunks, right? How do you eat an elephant? One bite at a time. How do you read a chapter? One chunk at a time. so, so one of the things that you're going to do is you're going to look at the highlights, right, of that chapter. So look, like when you open the chapter, you're going to see like the critical ideas or the critical points. Look at that. What are they telling you, right? Those are the things that you're going to be looking for. And then saying, will I understand that at the end of my reading of the chapter? Scan that chapter first. I go through, when I get my chapter, I scan it like, how many pages is this? And I look for those big like headlines, like the big headlines, and you have the mini subtitle headlines, right? So look at that and then chunk it, like, okay, I'm going to read this amount, and then stop and pause and make sure I know what I read, right? Make sure I know what I read. So you could read in chunks and do it like that. So you're breaking that up. Or that's my preferred method, so that I give myself an out, right? So I go through and I'm like, read like or to this page, right? Or to this, from one title to the next title, including all the subtitles. And then I can break it up into like that. And then that way I ensure that I understood that topic. And then I'm going to, read the next and read the next. And I always try to reread my notes in between so that, I understand what I'm reading. If you're reading the chapter, and guilty as charged, okay? When I was studying for the CHT and had no guidance, and people were just like, here's the book, read it, do it yourself. I did it alone, you should do it alone. Like, and that doesn't have to be the case anymore. You can actually get help for it. There's so many different programs, including mine, right? But I used to look at that, I would read it like as if I understood it, and I was just, because I was turning the page, right? Oh yeah, I'm turning the page. And then by the end of the chapter, I was like, oh my God, 2 hours went by and I don't think I retained anything. And it was because I was so busy trying to just like make notes, but it was really because I was just trying to copy everything that I read. Like, who's guilty of it? Raise your hand. Leave me a comment. Say, me, I did it. I did it. I know I am not the only person who's done that. Read a chapter and then like be like, oh gosh, I don't think I don't understand or remember anything. I don't think I read anything, right? When you do that, you waste so much time. Oh yeah, guilty, right? You're not the only one, I promise. You might just be the only brave one on this live that wants to say it. But tons of people have told me, so I know there are people out there that's just like me. I'm not the only one. So you can chunk up your chapter, or you can chunk up your time. So one of the methods to chunk up your time. So do 30 minutes and 5-minute break. 30-minute and 5-minute break. So you can turn your timer on and just read for those 30 minutes and then take a 5-minute break. Read for those 30 minutes and take a 5-minute break. I've tried both methods. That method doesn't always work for me when I'm reading. That method works for me when I do other like productive work. Reading, I tend to do the reading, scanning the chapter first, seeing how many pages I have, and then breaking that into chunks. Saying, I'm going to get from here to here, right? It's just like I'm going from Miami to Orlando, right? And maybe I'm going to stop halfway in between, because I know I like to stop at, exit whatever on the turnpike and refill my coffee, go to the restroom. It's the same type of idea. And then get back on the road, and hopefully I make it to Orlando in 3.5 hours. Sometimes I'm speeding. So try that out. But the other method can be really good for you too if you work well with that. 30-minute timer, 5-minute break. 30-minute timer, 5-minute break. All right. When you take too long to read or study, it really derails you from studying, and you think it's so hard, and becomes very easy to give up. So then you like, oh, that's too hard. I'll just come back in a few days. I'll come back in a few weeks. I'll come back in a few months. And then before you know it, it's been years. So you've been saying to yourself that you wanted to become a certified hand therapist and you wanted to sit for the boards and become a certified hand therapist. So have a plan, stay on course, and study in half the time, right, with all the topics that you have to cover by trying out some of these major tips. I have this and more in my hand exam prep program that can really cut the reading down time in half, explain concepts to you in a way that just makes it easier for you to apply for your patients, right? Keeps you structured, keeps you on pace, on track. So if you are an occupational therapist or a physical therapist and you're interested in becoming a certified hand therapist this year, November 2022, or even start now because you know you need a little bit extra time, you need about 12 months, then you can go until May. And you can ask me how that works, May of 2023. But don't wait. Do it today. Get started. Try some of these methods. Go back to the other video on how to create that plan for yourself in terms of a timeline, and let's get going so that you too can sit and become a certified hand therapist. But I always say, be the CHT before you become the CHT. Be the CHT in how you critically think, problem solve, and make decisions. So that when you study, by understanding these concepts, when you study, you don't have to be all about memorization. Not only will you be able to pass the CHT, you'll be able to use everything that you've learned and become an even better, more intentional therapist, getting results for your patients. Because really, at the end of the day, I don't know any therapist that just, want to not get results. You want to be the best. You can be the best. You can be the best, right? So I hope this helped you. If you just tuned in, thanks for tuning in, and you can watch it on the replay. So I'm going to put that up soon. As soon as I get off this, I'll put it on the replay. You guys can watch it. If you heard anything that was helpful, help your neighbor, type it into the comment, leave a chat. If you know any OTs or PTs that are interested in becoming CHTs and are looking for a guided program like this, or just need to hear these tips, then feel free to share this video, share this live with them so they too can get this information. So thank you so much for tuning in. I really appreciate it. Really appreciate everyone tuning in and watching and following. I hope that this helps you today and every day after. All right, I'm off. I've got someone waiting at the bar with a drink for me because why not? Why not? Why not have a good time? All right, guys, I'm off. Have a great night. Bye.